What we're discussing today is ovarian rejuvenation ultra, which is the third generation of ovarian rejuvenation. And this means so very much to me. Almost from when I started in the fertility field, I cared so much about women, especially women over the age of 42, but it can be any age, that were unable to have a child because of egg quality issues. And every time I would go to a fertility conference, I would see a meeting, virtually all of them, that said what to do about women like that. And I went to these conferences, and then at the end of every conference, they said, well, nothing really works. And it's been that way for many years. And of course, things have come up, DHEA and a variety of other things that have given people hope. But in the end, nothing has really worked. And so I'm extremely pleased that now we have something that does work. It doesn't work for everyone, but we have something that works and can help women who right now are hopeless. So what we're discussing is really the most challenging area of fertility. IVF success rates have become extremely high. Almost any woman 35 and under, unless she has premature ovarian failure, has an extremely high chance of success. It's almost unusual to fail, not to end up with a baby if you're 39 and under. But once you get to 40, it gets really, really difficult. You have fewer eggs and the quality of the eggs is reduced. And so when you see a fertility specialist, they say, you have low ovarian reserve, you have a low AMH, high FSH, low antral follicle count, a long list of things that they say that are very depressing, because what they say then is you should use an egg donor. Now, egg donation works and it's not a bad technique, but for many women, they want to try to have a baby themselves before they go to egg donation. Now, some of the other problems that are commonly seen is sometimes women will make eggs, but they're low quality eggs, or they'll make embryos, but when they're genetically tested, they're found to be abnormal. And so there's all these hoops you feel like you have to jump through in order to be successful. The problem here really begins with this slide. Look at the effect of age on fertility. It's incredible. You can see that at the age of 20 to 24, fertility is very high, and then it progressively falls. Once you hit 30, it falls even more quickly. And once you hit 37 and 40, it falls so quickly, so fast, that women who were fertile 3 or 4 years before are no longer fertile. It's just a difficult problem. And in addition to not getting pregnant, when women do get pregnant, look at the miscarriage rate. It goes up progressively. So I think for many women, it's not just getting pregnant. They'll get pregnant, but then they'll miscarry. And it's a very, very difficult situation. Let's look at what's really going on. What's happening is that the number of follicles, that's another way of saying eggs, as we'll see in a few moments, falls very rapidly over time. And if you look at this graph, it actually mirrors the fall in fertility that we saw in the previous slide. And one of the most critical reasons they're important is it's small follicles that make AMH. And AMH stands for anti-Mullerian hormone. And these days, anytime you go to a fertility specialist, they're going to measure the AMH level. And they're going to give you a prognosis based on that AMH level. Well, what is it that makes AMH? It's small follicles. It's follicles that are 8 millimeters or smaller. They're the ones that make AMH. So when you go in and you have an AMH level and it's low, it's because you don't have very many follicles within your ovaries. And not having very many follicles is associated with not having very many eggs. And when you don't have very many eggs, then of course, pregnancy rates drop. So the AMH falls with age. What does it mean to rejuvenate? We say ovarian rejuvenation. What does that mean? Well, to rejuvenate means to make young again, to restore to a former state, to make new again. And you remember those slides that had the graphs on them, and it showed how there was this progressive fall in egg number over time and a progressive fall in quality. And we saw that because the miscarriage rates go up. And so our whole goal with ovarian rejuvenation is to try to return that woman to a younger age. when her egg quality was higher, when she had more eggs? And is there a way to do that? That's what we're going to be discussing today. So we use blood to start the process of ovarian rejuvenation. And of course, the blood is critical in virtually all aspects of life. And look only at the bottom though for now, the healing of injuries, because ovarian rejuvenation takes advantage of the processes that the body uses to heal injury. So there are multiple blood components, but the one we're going to focus on today are platelets. Now, when we were in school, we learned that platelets stop bleeding. And that certainly is one use of platelets, but it's not the only use, the only value of platelets. So they do stop bleeding with blood clots, but they direct the repair of injured areas within the body. So when you suffer an injury, many cells go to that area, but one of the most critical are the platelets. And then when a platelet is activated, and one thing that activates it is injury, it releases factors that cause stem cells to begin to grow. And so you heal that area. And so if you cut yourself, even a few days later, when you look, you see that it's largely healed. And that, again, is primarily due to the platelets. So these are very, very powerful cells within the body. When a platelet's activated, and it can be activated by injury, as I mentioned, or we can use other ways of activating, which is what we do in ovarian rejuvenation, it releases many growth factors. And there's a list there of some of these growth factors. And these growth factors do many different things. But one of the most important things that the growth factors do is they stimulate the growth of new blood vessels. So they bring new blood, more oxygen, more nutrition into the area of the ovary. And we think that that's one of the most critical aspects of ovarian rejuvenation. It's also possible, we're not sure if this is true or not, it's something we're doing research on now, it's possible that platelets actually activate what are called ovarian stem cells. And if they activate them, they would be able to generate new eggs. And so this has been an active area of research for us for a while. And we're looking at ways of determining if that happens, and if it happens, how we can capture that, how we can maximize the ability of platelets to do that. So I'm going to go through some background on PRP for ovarian rejuvenation. The first thing is we use platelets from a woman's own body. We don't take platelets from someone else and put it into her body. So it's a very natural process. We activate the platelets. Once a platelet's activated, it begins to release those growth factors, and you saw a list of those a couple of slides back. Then we inject the platelets, the activated platelets, into each ovary. Rare cases, we're not able to get into both ovaries, and it doesn't seem to matter that much, but our goal is to inject the platelets into each ovary. And we use ultrasound to do that, because ultrasound allows you to see the inside of an ovary. And when you can see the inside of the ovary and you can see the needle tip, then you can be sure that you are placing the PRP or the implant or whatever it is we're doing into the correct locations. So after we isolate the blood, after we draw the blood, we put it into a centrifuge and spin it down. That's what everyone calls it, kind of the colloquial term for it. And you can see here on the left, there's poor plasma, platelet-rich plasma, and then the red blood cells. Obviously, we don't want to inject red blood cells. What we want to inject is the platelet-rich plasma. And tubes have been designed that allow us to very quickly and accurately isolate platelet-rich plasma. And so in the center tube here, what you see is that blue area, and that's the platelet-rich plasma. And so we go in and we remove the platelet-rich plasma into a syringe, and then we use the syringe in order to inject it into the ovaries. And this is a still showing exactly that. So we use the ultrasound to identify the ovaries, and there are special places that are best, special ways to get into the ovary that are best. And then we place that needle not only in one place as it shows in this slide, but in multiple places around the ovary to make sure that we have enough PRP going into the ovary and to make sure that it's being placed into the correct location. So we're going to watch a slide now of an animation that was done by two of my staff members. I'm very proud of them. Don and Luke did this, and let's see what you think. I think that was a very nice animation, and it leads us to the next section of the talk when we'll discuss implaf and ultra. Let's go through the generations of ovarian rejuvenation. The first generation, I call it generation 0, was actually done in Greece. And the first paper from this generation 0 was published in 2016. And what they did was they put patients to sleep. They then did a laparoscopy. They lifted the ovary up, and they injected the ovary in multiple locations and injected PRP. There are still centers in the United States doing generation 0, which I think is not a good idea at all. I think using anesthesia makes very little sense. In doing a substantial surgical procedure, it includes significant risk for patients. So we completely disagree with doing that. Some pregnancies have been reported. The first paper from Greece and subsequent papers have reported babies being born. And by the way, now even in Greece, they are following what we do, which began in generation 1 of ovarian rejuvenation. Instead of doing surgery, we do the ultrasound method. And you've seen animations and you've seen illustrations of that. The problem with doing surgery is you cannot see where the needle is because the outside of the ovary is white and you cannot see through that. But with ultrasound, it's very simple to do. So the risk to patients is far less with generation 1, and we're able to be much more accurate about exactly where we place the PRP. And so this particular technique was first done by Gen 5 fertility physicians, and we're proud of that. But it was just generation 1. We then went on to generation 2. And generation 2, we started using different kinds of needles, thinner needles. We started being very precise about exactly where we placed the PRP, and we also began to inject implaf, which is one type of enriched platelet factor. So I'm sure you gathered this, but from that animation, but the difference between PRP and enriched platelet factors is that instead of injecting activated platelets, which is what we do with PRP, we're actually concentrating. We're allowing the platelets to release these growth factors over a period of time, so the concentration of the growth factors is much higher. We then isolate the growth factors and inject them into the ovaries instead of injecting the platelets. And so over time, we've had many women who did not succeed with PRP, and they did succeed though with implaf. There's a use for each one of these. None of these are excluded, and patients can choose whether they want generation 1, generation 2, or generation 3. And I think that there are reasons for patients to pick one or the other. So this is an illustration of the key difference between generation 1 and generation 2. So on the left, you see the platelets, which are activated, and then they're placed into the 2 ovaries. On the right, you see the platelets that are then activated. They're incubated to allow the growth factors to be released and allow us to isolate and capture those growth factors. And then they're placed into the 2 ovaries, as you see at the bottom. So generation 3 is what we now call ultra. So it's newly created. We've done several of these cases, but it's an attempt to help all patients. Because as I mentioned, some do better with 1, some do better with 2, but there are others that I think will do much better with generation 3 by taking them both at once. In fact, the first person that we did ultra with had been trying for years, and 3 weeks later, she became pregnant. So it's an amazing technique, although it's absolutely not critical for everyone. We have a patent pending on it because we want this to be done right. We don't want people to hear, oh, well, you could just combine those 2, and then they do it with patients, but they don't do it correctly. So we have a patent pending. It has the same low risk, and what it involves is a combination of PRP and the platelet activating factors, both of them at once. And we also have up to 6 enhancements that we use depending on the specifics of the patient that we're treating. So there are many secrets to successful IVF, and I give talks on all the key elements in being successful with IVF. But in the end, I think probably the most important single factor is the egg. What's the future? Is there generation 4? I think there probably will be. It's in my mind now. We're also looking at other techniques, even more dramatic techniques in the future, but they require more research, and they will not be available, I'm sure, for 2 or 3 years. We have more publications that have been submitted and hopefully will be approved, and they'll be out soon. And so, you know, our goal is to find a way to overcome this terrible, terrible situation. And every day I see patients with this every day, and nothing would make me happier than for us to find a way, and then we'll share it with all other fertility specialists, a way to overcome this most difficult problem, this vexing problem. And we're making progress on it. We're not where we want to be, but we're glad that even though we're not where we want to be, we can help many women have an outstanding chance of having a baby. And some of those women will have a baby that's healthy when they never thought they could. This is a picture of our center that we're very proud of. And you can see that it's it's adjacent to the Torrey Pines State Park. And then in the distance, you can see the Pacific Ocean. So it's a very peaceful place. And it's a place that all of us can work together to help women succeed with this and other problems. Because in the end, this is what matters. Doesn't matter what research you're doing. Doesn't matter how much better you make the eggs. What matters is the babies. And I love these kids. And it's a picture of me there. And in the end, this is what really matters.